So this was an important study looking at immunogenicity of SARS-CoV-2 vaccination in hematopoietic cell transplantation and chimeric antigen receptor CAR-T cell therapy recipients. So the key findings so we looked at close to 100 patients, so 88 patients in the initial cohort, and then the expanded cohort had 126 patients. And the vaccine immunogenicity we defined based on anti-spike protein receptor binding domain antibodies and neutralizing antibodies. And the protective levels on each of those were over 100 or over 30% that provides protection to COVID-19. And we saw that the responses were close to 72% in transplant CAR-T patients compared to over 90% in the general population. And the important factors, one of the major factors that impacts the immunogenicity of the vaccine is time since transplant and cell therapy. So in patients who received vaccine over 1 year after their transplant or cell therapy, the responses were close to the normal population, over 80%. But patients who received it earlier, it was close to 50%. And there was no difference in patients who received it after 3 months or after 6 months after their cell therapy. And other factors that influence the immunogenicity or humoral response were graft-versus-host disease or immunosuppressive therapy, or being an allogenic transplant recipient. So the key takeaways are, so these antibody measurements are not the standard of care in clinical practice. So I think as the current recommendations state, the vaccination should start at 3 months and complete the primary series, and the patient should receive a booster 1 year after transplantation.